Thank you. Good morning. Bonjour. Bonjour, Annie. I'm Dr. Nell Wyman. I'm originally from Mishi-Bewittagong First Nation in Treaty 5 territory, which is part of the Anishinaabe Nation. I serve as the Chief Medical Officer at the First Nations Health Authority here in British Columbia. I want to acknowledge that I'm speaking today from the traditional, ancestral, and unceded territories of the Musqueam, the Squamish, and the Tsleil-Waututh Nations. The FNHA is the first of its kind in Canada, created by and for First Nations people in BC to support their health and wellness. Since before the toxic drug crisis was declared a public health emergency in 2016, we have been on the front lines addressing the disproportionate impacts on First Nations individuals and communities that have worsened historical and systemic inequities and intergenerational trauma. Our role is to engage with communities and continue to expand our public health response to this emergency in collaboration with our health governance partners. Our data for BC First Nations people is alarming. In 2023, we lost 448 First Nations people to toxic drug poisonings. This was a 10.3% increase from 2022. First Nations people died at 6.1 times the rate of other BC residents. Women and young people are particularly overrepresented. Since 2016, we have lost 2,356 lives. These data are not just numbers. They represent our family members, our aunties, our youth, our elders. They are loved and missed. This is only the tip of the iceberg. There is a vast number of other substance use-related harms, such as acquired brain injury, disconnection, and mental, emotional, and spiritual distress. Between 2015 and 2021, life expectancy for First Nations people in BC fell by 7.1 years, driven both by the COVID-19 pandemic and the toxic drug public health emergency. This reveals the long-term losses and harms to our communities and the urgent need for critical action. FNHA's response to date has been rooted in cultural safety, community engagement, and innovative initiatives derived from shared learnings across our 5 regions. Our approach is community-driven and nation-based and supports a continuum of care that meets people where they are at in their wellness journey. We have developed and funded culturally safe community-based programming grounded in harm reduction, which includes expanded OAT availability, establishing peer support groups and outreach teams, funding First Nations-led overdose prevention sites, and increasing access to harm reduction supplies in communities. Supported public education and awareness through our Not Just Naloxone training program and communications campaigns, expanded cultural programming, including through land-based healing initiatives, and funded rapid access to treatment and healing centers that incorporate culturally safe practices. While progress has been made, we continue to face significant barriers. These include the inaccessibility of substance use services in communities, particularly in rural and remote areas, and the lack of long-term sustained and flexible funding, including for cultural programming. We cannot ignore the role racism and discrimination play and the lack of recognition of the intergenerational impacts of colonialism, resulting in culturally unsafe healthcare. This is further compounded by the stigma surrounding substance use, which prevents people from accessing care. In closing, the toxic drug crisis of 2024 is more deadly than it was 9 years ago. The major driver of deaths is due to the increasingly unpredictable, dangerous, and potentially lethal unregulated drug supply. The politicization of this emergency threatens progress, especially against the backlash against proven, evidence-based harm reduction measures that can save lives, hits First Nations people the hardest. deepening existing inequalities. Every loss is felt deeply by families and communities, and we call upon our system partners to implement timely solutions which are First Nations led, culturally safe, trauma informed, and appropriately funded. I thank you for your attention today. Thank you. Merci. Megwich.